One of the unique features of the Giraffe OmniBed and Incubator Care Station bed is the mattress. Depending on your or the baby's needs, you can slide out, rotate, and/or tilt the mattress. You might need or want to use this feature when performing a procedure, such as placing a central line, other clinical needs, or allowing a mom to snuggle with her child. Since you will be opening a bedside panel or portholes when you slide out, rotate, or tilt the mattress, we recommend turning on Air Boost to help with thermal stability. To slide out the mattress tray, open the panel on the side of the bed where you want to slide out the mattress. Place a finger in at least one of the holes in the mattress tray, or grasp the corner of the tray on that side. To rotate the mattress, grasp the edges of the internal mattress tray and turn it as desired. The mattress in both the OmniBed and Incubator models also tilts up to 12 degrees to allow feet up or head up positioning of the patient to support the care of the patient when deemed clinically necessary. Keep in mind that tilting the mattress can result in uneven heat distribution. You can tilt the mattress either by lowering the bedside panel or through the portholes. To tilt the mattress, pinch the tilt mechanism located inside the bed area at the control panel end of the mattress platform. Release it with one hand while placing the other hand on the humidifier end of the mattress platform. Holding the mattress at the humidifier end helps to control tilt speed. The mattress rocks at its center, so pushing down on one end raises the other. Maneuver the mattress platform into the desired position and release the tilt mechanism to lock the mattress platform in position. Whether you're sliding, rotating, or tilting the mattress, make sure you monitor the patient carefully while sidebed panels or portholes are open. Always check for cables, tubes, and other obstructions before, during, and after moving the mattress. Ensure the baby is in the center of the mattress. Never leave the patient unattended when bedside panels are open or when the porthole doors are open. After completing the desired positioning, close and ensure all portholes or bedside panels are latched and secure, as previously described.